What are the signs and symptoms of polycystic ovary syndrome, or PCOS? Let's talk about it. Polycystic ovary syndrome is a condition in young women in which they do not ovulate regularly and have very high levels of androgens or male hormones in their systems, as well as high inflammatory markers. Signs and symptoms are a little bit different. Signs are what medical providers perceive on your examination and in your blood work or imaging studies, while symptoms are what you experience. The symptoms of PCOS are irregular periods due to not producing enough progesterone, hirsutism, which means male-like body and facial hair, acne on your chin, your neck, your shoulders, or male pattern baldness, infertility due to infrequent ovulation, obesity with fat deposits mainly around your abdomen, sleep disturbances. Those occur in about half of women with PCOS because of an altered pattern of hypothalamic luteinizing hormone releasing hormone and pituitary LH and FSH. Luteinizing hormone affects your circadian rhythm. Now, the signs of PCOS are overweight central obesity with visceral fat deposited in your internal organs. We see that on imaging studies. Elevated DHEA and testosterone in your blood, low sex hormone binding globulin in your blood, low mid-luteal phase progesterone we measure in your blood, high AMH, anti-Müllerian hormone, is also known as Müllerian inhibiting substance. It's a type of hormone secreted by the ovarian follicle as it matures. AMH reflects your antral or resting follicles known as your ovarian reserve. Too much AMH can actually stop ovulation from occurring. In a normal ovary, AMH prevents the premature development of a follicle, and when AMH levels are too high, it stops the maturation of an egg before it can actually ovulate. We also see in your blood elevated hemoglobin A1C levels. That indicates insulin resistance. We can see high blood pressure if PCOS has progressed to metabolic syndrome, high cholesterol, particularly high LDL and low HDL, plus high triglycerides. PCOS is believed to be multifactorial, partly genetic. However, we're not really sure which genes are responsible. Insulin resistance is not included in the diagnostic criteria, but it's consistently noted among many women with PCOS, especially if they have high androgen levels. Now, there's a strong evidence that cardiovascular disease risk factors and disturbance in carbohydrate metabolism are increased in patients with PCOS compared to healthy women. But not all women with polycystic ovary syndrome patients are overweight, but they can still be insulin resistant. Because polycystic ovary syndrome is a metabolic disorder, which means central obesity, high blood pressure, high triglycerides, high cholesterol, and insulin resistance, you do have an increased risk of developing heart disease and diabetes. A diagnosis of PCOS is made when you have at least two of the following three signs. You have irregular periods or no periods. You have higher levels of circulating androgens either in your blood test, or we see androgens on your face through facial hair and body hair growth or scalp hair loss or acne. And number three, we notice polycystic ovaries on an ultrasound, meaning you have more than 20 follicles, partly developed eggs, that are visible on one or both of your ovaries, or the size of one of both of your ovaries is increased more than 10 milliliters. You do not need to have an ultrasound if you have irregular periods and evidence of high androgens. Now, the best way to diagnose polycystic ovary syndrome is looking at the blood work. Women with polycystic ovary syndrome have elevation in their male hormones, both in their testosterone and DHEA. They have low sex hormone binding globulin, which tends to bind to testosterone. So in PCOS, there's more free testosterone. That contributes to the hairiness and acne. Adrenal DHEA is also elevated. DHEA is an androgen or an anabolic hormone that tends to be high when you're under stress, and it can be converted into testosterone and contribute to hirsutism as well as weight gain. PCOS seems to be becoming more of an issue in young women. While there is a genetic component, lifestyle contributes to developing PCOS. High stress, too many carbs in your diet, too much sugar, not enough exercise. PCOS is not necessarily a gynecological disorder, it's a metabolic disorder, which means that if you don't get it under control, you're more likely to develop issues with insulin resistance, type 2 diabetes, chronic obesity, heart disease, or stroke. So it's super important that PCOS is diagnosed and treated as early as possible. Most of the treatments are lifestyle treatments. There are also some medications used for PCOS, but the best treatment is to balance out your hypothalamus because polycystic ovary syndrome is truly hypothalamic dysfunction. If you want more information about treating polycystic ovary syndrome, check out my next video.